Welcome, everyone. Thank you for joining us for today's webinar. I'm Dr. Alexander Vigo Valentin and serve as the Public Health Advisor and Hispanic Latino Health Policy Lead at the U.S. Department of Health and Human Services Office of Minority Health. Today's webinar, Niños, Saludables, addressing childhood obesity in Latinos, is in observance of the Hispanic Heritage Month. The Office of Minority Health, in collaboration with the U.S. Centers for Disease Control and Prevention, Unidos US, and University of Texas Health San Antonio, will highlight prevalence data and explore the factors such as cultural, behavior, and environment that have contributed to the increase of obesity in Latino children of all ages over the past 30 years. Just a little housekeeping before we get started. All webinar attendees will be placed on mute, and if you have any questions during the presentation, please type them into the question box on the right bar of your screen. We have time for questions at the end of the webinar, and without further ado, let's get started. Next slide. I'm pleased to have the opportunity to introduce Dr. Matthew Y.C. Lin, Deputy Assistant Secretary for Minority Health and Director of the Office of Minority Health, to provide us with opening remarks. Under Dr. Lin's leadership, the Office of Minority Health oversees the implementation of the HHS Action Plan to reduce racial and ethnic health disparities and the National Partnership for Action to End Health Disparities, and work on key HHS priorities, including the opioid epidemic, childhood obesity, and serious mental illness. An orthopedic surgeon, Dr. Lin has spent most of his professional career serving as primarily minority population in the San Gabriel Valley of California, where he served as a member of the board of directors at the Al-Habra Hospital and Gabriel Medical Center. For the past 2 decades, he has also been involved in the medical relief efforts for natural disasters worldwide. Dr. Lin arrived in the U.S. from Taipei in the early 1970s, completing residencies in Baltimore at MedStar with Union Memorial Hospital and Johns Hopkins Hospital. He has also served on the faculties of the University of Southern California, Western University of Health Science, and the California North State University College of Medicine. With you, Dr. Lin.
Hi, good afternoon, everyone. I'm Dr. Matthew Lin. I'm the Deputy Assistant Secretary for Minority Health. I want to welcome you to acknowledge Hispanic Heritage Month and the contribution made by the Hispanic community in the United States. I would also like to thank today's speakers. They are federal and private sector partners who are helping to raise awareness of gap in health among community in America, so that we can get your help in seeing that they are addressed. The disparity we are focusing on today involving children and childhood obesity. Obesity affects about 12.7 million children and adolescents in the United States, and the rate among Hispanic children appears to be higher than those for children from most of other minority populations. Our panel will highlight data regarding the increase of obesity in Latino children of all ages and explore the factors that contribute, such as culture, behavior, and environment. You will also hear examples of programs that can help us as we work on those issues. Again, thank you for joining us and for everything that you do to reduce health disparity and advance health equity in the United States. And now I will turn the webinar over to our moderator, Alexandra Vigo, our Hispanic health policy expert at the Office of Minority Health.
Thank you, Dr. Lin. So the objectives for today's webinar are to, one, provide an overview of the prevalence of childhood obesity in Latino children and youth. Two, identify factors contributing to the increase of childhood obesity in Latino children. And 3, highlight programs and resources that are addressing childhood obesity in Latino communities. Now turn the time over to our 3 presenters. So today we have Captain Heidi Blank, obesity prevention for the Institute for Hispanic Health, Unidos US, and Eric Moreno, Research Area Specialist, Senior for the Institute for Health Promotion Research at University of Texas Health, San Antonio. Next slide. Our first presenter is Captain Heidi Mitchell Blank. She has more than 15 years of CDC experience as a United States Public Health Service officer and has authored over 90 epidemiological papers and reports in the areas of nutrition, physical activity, obesity, and environmental exposures. Dr. Blank oversees the CDC's monitoring of state obesity prevalence and key behavioral, environmental, and policy support for healthy eating and active living. Her work focuses on changes in environments and policies across multiple settings, including child care, schools, medical care, and communities, with an emphasis in improving health equity. Dr. Blank received her PhD in nutrition and health science from Emory University, where she also holds an adjunct professor position. And now with you, Captain Blank.
Thank you. Good afternoon. It's my pleasure to be here with you today. I'm very excited to be able to share information that hopefully can help individuals and stakeholders related to childhood obesity among Latinos. Next slide. So as we mentioned, today I'm going to highlight just a number of studies and factors contributing to obesity. We won't have time to go into all aspects and factors related to obesity, but hopefully this can give you a sense of some of the areas where we can work together to help support families, improve behaviors, and really ensure that all of our children are growing up at a healthy weight. Next slide. So I'd like to start off by talking a little bit more about childhood obesity to get a shared sense of the concerns that we have. We know that childhood obesity, which in many of our studies is measured using body mass index, so weight and height, and having a child who has the body mass index at the 95th percentile falls into the classification of obesity. And so when we look at what happens with children who have this increased adiposity, we know that it can affect many of the body systems. So this graphic shows a number of aspects. So when we think about obesity, it's not the cosmetic issue, it's not the issues that sometimes are highlighted, but really thinking about the internal issues that are putting our children's health at risk. This is both physical and mental health. So when we look across our body systems, we have issues for children related to sleep, so sleep apnea, as well as breathing, such as asthma. We have issues related to the liver, such as fatty liver and gallstones. We have real structural issues, including issues with pain, with arthritis and joint pain. We also have a number of conditions related to cardiovascular disease, as well as issues related to diabetes and other areas. Another acute issue, and I am a mom, and so I think about the health and happiness of my children every day. We think about issues related to mental health, so poor self-esteem, anxiety and depression, fitting in, bullying, stigmatization. So for all of us who think about the health concerns of obesity, we have the immediate concerns of what's happening to their bodies and also what happens as obesity tracks into adulthood. Next slide. So we know that children who are overweight in kindergarten are 5 times more likely to have obesity as adolescents, and this is compared to their normal weight peers. And we know that those children also then who become adults with obesity are at high risk for conditions such as heart disease, type 2 diabetes, and certain cancers. I've made an asterisk here to point out that we now know there's 13 causally related cancers related to increased weight gain and obesity, and we've recently released a report on this area. We also know that women and men can experience fertility problems as well as social and mental health consequences. So when we dig a little deeper to understand what's happening in the body because of these increased adipose cells, we get into a lot of physiology. We get into areas related to our body systems. Some of that has to do with an increase in free fatty acids, clotting factors, immune function, inflammation, the mechanical stress, what's happening with our pancreas, with oxidative stress, as well as hormones. So we've been learning over the last 10 to 20 years much more about what it means to have obesity. Early on, we really didn't know much about this. We thought it was an organ or a tissue that was providing storage of energy, but we really didn't understand how it was affecting all these body systems. Next slide. So we're already thinking then about how do we monitor the types of approaches that can impact and really prevent and control obesity. So this slide shows a model of what we think about when we're trying to have surveillance, research, ways that we can consider how to support children and families. So when we think about the highest level of this diagram, we can look at things like federal and state programs, different policies and incentives, different things that affect us at both the national and federal policy, rules, regulation types of programming. We think about the community, we can think about things that are within the local boards of health, whether it's with our architects and designers, so things like zoning, complete streets, land use, shared uses. Are folks able to use the track at the local school, the local university on the weekend? We also talk about community coalitions and how groups have come together like food policy councils. And then we think about the key places where children spend their time. So we think about things like the child care or the school. We think about the parents who are also can model behaviors and impact their own health and their children's. So we think about work sites. And then we think about where people seek their care, quality preventive care, including health care. So again, we can be monitoring the types of supports that are happening in those key organizations. We also know that interpersonal relationships are very important for obesity. We know that how the family, the types of food practices it has, parenting practices, parental health literacy, peer influences, social networks, all can impact the type of healthy habits and limit settings that can impact obesity prevalence. And then we do a lot of monitoring at the individual level. So we'd like to think about things around nutrition, physical activity, sleep, screen time. And so we have a number of systems that do capture information around folks' both knowledge, attitudes, behavior, as well as weight and BMI. So today I'm going to share a little bit about the data that we have down at this lowest box. Next slide. So next slide. Next slide. Okay, thank you. So as mentioned, when we look at the prevalence of overweight or obesity among our youngest children in the United States, this is data that both the CDC and the USDA have put out related to looking at children. And you can see here, we've got overall among children who are 2 to 4 who are part of the WIC population, it's about 31.2%. When we look over to the right-hand side and we start looking at the data stratified by race ethnicity, you can see we're seeing somewhat higher prevalence among children of the Hispanic at 35.8%. So you're starting to see some disparities emerge in this overweight and obesity data. Next slide. When we've looked at trends in this over time, so again, these are children on the Women and Infants and Children's WIC participation program that is part of the USDA Food Assistance. This diagram shows, for example, from 2000 to 2014, the prevalence of obesity among this age group of 2 to 4-year-olds. We can look at the different parts of the legend of the slide, but I have a circle here to specifically look at Hispanic children. You can see it's kind of a good news and a bad news story. So we can see that in the U.S., since about 2010, the data has started to show some modest declines in childhood obesity. And you can see this among most of the race ethnic groups. You are seeing that here in the red circled area for Hispanic children. But I'd like to point out the magnitude. So if you look at our left side, we see the percentage of children with obesity. And as you can see here, American Indian Alaska Native have the highest prevalence of childhood obesity, but they're followed closely by Hispanic children. This is compared to the overall rate here at about 14.5%. We're seeing we're closer to 17 to 18% with Hispanic children. Next slide. This again is another graphic from the data we have at the national level. This is from our National Health and Nutrition Examination Survey, so NHANES. This is the data that we have from the most recent years of 2011 to 2014. You can see here that we're seeing across the 2 to 19-year-olds, so all youth. We're finding the lowest among Asian American children here, who are represented with the green bars, but unfortunately we have the highest levels here in the Hispanic children. So overall here from 2 to 19, you can see 8.6% versus 21.9%. Next slide. This is some of the adult data that CDC also provides. This is our last release where we combine data for 3 years to have adequate sample size. These maps show, this is both adults who are caregivers or non-caregivers. So we can see here, compared to the map of non-Hispanic white individuals, we have many more states reporting a high proportion of adults with self-reported obesity. The Hispanic populations here in red are states that have at least a third of their population having adult obesity. And this is really important because we know quite a bit that shared environment as well as shared genetics play a role in childhood obesity. Next slide. So next I want to move on to some of the behavioral data. Next slide. So when we're looking at early nutrition, this is a slide that we have on breastfeeding initiation among U.S. infants. This is the latest data that we have that goes out to 2014. We use this from a National Immunization Survey that CDC conducts. And what you can see here is a good news story in the sense that if you're looking across the lines over time here, and we have the Hispanic infants in a gray line, they have very similar rates of moms starting to breastfeed, initiating breastfeeding, that is similar to the non-Hispanic whites. Next slide. The next story here that I was looking at the moms who are breastfeeding their children out at 6 months. Again, the same survey in infants between 2009 and 2014. But here we see a drop-off. So unlike at the initiation where we saw similar prevalence between non-Hispanic white infants and Hispanic infants, we can see here that we have a lower prevalence of children still being breastfed at 6 months. Next slide. Next, we're going to look at a little older children, 2 to 19, who are looking at here, for example, on fruits and vegetables. So this slide is specific, again, from our national survey, and it's looking at youth 2 to 19. What we can see here is that about 1/2 of non-Hispanic white youth consume juice on a given day, while we have higher percentages here for non-Hispanic black youth and Hispanic youth. So about 12% higher here, showing that children are consuming juice. We know from our dietary guidelines that a small proportion of juice, around 4 ounces, can be appropriate for young children, but too much juice has been shown to be a poor dietary factor. Next slide. Next slide. Great. So this slide is looking at the counterpart, which is total fruit. And what we can see here when we look across the different age groups and we look specifically at how much fruit they should be consuming, we can see that Mexican American and other Hispanic children consume significantly less fruit than total compared to other race ethnicity groups. So I won't go line by line here, but it definitely shows that there is about a 10 to 12% lower prevalence here of consuming the recommended amount of fruit. So although we're seeing a pretty good magnitude of children consuming some fruit, they're not meeting the recommended amount. Next slide. And this is similar data that we have looking at vegetables. And so this bottom line here that we've captured here in the red show that we've got some work to do with Hispanic children related to consumption of vegetables. But we do have good news in the sense that from a culturally relevant perspective, we are seeing Mexican American children consuming more dry beans and peas than other race groups. And we know that legumes are a very important part of the vegetables. And so there's definitely a good news related to that component. But as you look across the different areas related to things like dark green vegetables, we definitely have some areas where we could help support families more in some of those subgroups. Next slide. And this is another slide, again, looking at consumption of vegetables on any given day. So again, positive in the sense that we find that a higher proportion of Hispanic youth consume vegetables, but unfortunately, other vegetables many times fall into the starchy, and others can be some types of vegetables that aren't providing as many nutrients as those such as dark green or red and orange. But pretty good here, showing that across race ethnic groups, Hispanic children are doing fairly well on vegetables. Next slide. Another dietary factor we want to look at is sugar-sweetened beverage intake. So this is national data, again, looking at the 2011 to 2014 data here. And this was a study published earlier this year. We can see here what we've done is circled the Hispanic children, looking at both boys and girls. And so if you look across the calories that come from sugary drinks, so sugary drinks can be things like regular soda, sweetened fruit drinks, your aqua frescas with extra sugar. This could be sweet teas or other types of coffees that have extra sugar. We can see here that our children are getting about 156 calories in boys and about 115 in girls. So we know that sugar-sweetened beverages don't provide other nutrients. Even though they're water-based, they're often not providing any other benefits to the diet. So this is a large proportion of calories coming from a dietary contributor that isn't providing a lot of other nutrients. Next slide. This is data we also have. This is self-reported data that we have in high school students by race ethnicity, and this is the Youth Risk Behavioral Survey from CDC, and this was published this year as well. The good news is, as we look across the data from 2007 to 2015, we can see that all of the racial ethnic groups have been reporting a reduction in regular soda. And so if you look across, we can see here that we started in Hispanic children at about 33.4%, or a third back in 2007, reported having a soda on that day. And over time, we've brought this down to about 21.7. So it appears that some of the efforts related to school and home-based approaches are helping, but unfortunately, we're still seeing about 22% of children still consuming regular soda. And I just point out that this question is only one specific type of SSB. Next slide. This data is the counterpart to sugary drinks, and that's looking at plain water intake. So we also really like to encourage plain water, milk, and other types of more nutrient-dense opportunities for beverages. And so this data is looking at the types of water, plain water, tap water, or bottled water. So if we look, for example, at non-Hispanic white children on our far left of the slide, we can see in milliliters here about 456 being consumed by plain water, and then our tap and bottled water components of that. If we jump to the middle of the slide here, we can see that Mexican-American children in the national survey are much lower, 374 mils. Again, pretty low on the tap water, and as well as in other Hispanics not being as high as non-Hispanic whites. So one of the areas that we've worked in a number of efforts at CDC and with counterparts in other areas is understanding folks' perceptions of tap water safety, perceptions of the fountains in schools, fountains in the parks, fountains at the house, and ways that we can really support individuals to consume free drinking water or bottled water. Next slide. And then I wanted to point out an aspect related to household food insecurity. So we know in research studies as well as data we have from across the U.S. That we are often seeing households, especially households with lower resources, can experience both food insecurity and obesity within the same household. And many times this is coming from the consumption of high energy dense foods such as salty snacks and other kind of processed foods. They may be high in calories but not in nutrients. So this is just a slide to show here what we have from the USDA, again, related to their household food insecurity survey. And this is tracking Hispanic households between 2000 and 2014. And so we can see here, if we look at just general food insecurity in the top blue line compared to food insecurity from all U.S. households, we're seeing a much higher magnitude of non-Hispanic households reporting food insecurity. And I think this is important information for folks who are thinking about ways to improve nutrition. We also need to be concerned about social determinants of health and other parts of what's happening in that nutrition perspective. In this slide, I wanted to move away from nutrition and think more also about physical activity. So this data is data we have, again, from our Youth Risk Behavioral Survey from CDC. And this is looking at high school students meeting the aerobic physical activity guidelines. So again, these are the types of moderate and vigorous physical activity that help a number of health areas. So looking at this, we can see that in general, we see more physical activity being conducted by males and females. You can look at what happens with age group, and then looking over here at race ethnicity. Unfortunately, all of our high school students could do better in meeting aerobic physical activity, but you can see that Hispanic children are about the same as non-Hispanic Black, a little bit lower than white, but just another area that we really need to support our youth on improving that behavior. Next slide. And then I wanted to also share data that's come out related to adolescents, again, 10 to 17, and the types of neighborhood supports that they have for supporting the physical activity. This data is from the National Survey of Children's Health from 2011 and 2012. You can see this is a study of about 41,000 adolescents, and it looks at some questions related to the type of neighborhood supports they have that they can come home and actually take part in physical activity. And if we look at this, in general, we have about 65.4% report that they do have a supportive environment. If we come down to the bottom here, if we look at non-Hispanic white adolescents, it's about 67.2, Blacks at 60.0, Hispanic 61.6, and multi or other non-Hispanic about 70.1. So you can see there's a slight disparity here. Again, it's another area that we can consider in our communities on ensuring that there's supportive environments for physical activity among our children. Next slide. Next slide. Next slide. So I just did want to point out that a number of the data that I've shown today are available for visualization from our website called Data Trends and Maps. I definitely would point people to this as a resource to help find more information about your state, community, or the national information. Next slide. And this information will be on the archive, but definitely we're interested in folks following us through our website, through our Facebook, as well as if you have additional questions, you can email me at my address there. Next slide. And I'll save this to the end, but I also did want to make sure that folks were aware of the programs that we have to reduce racial and ethnic approaches, the types of disparities that we're seeing for tobacco, physical activity, and poor nutrition. Next slide. And to make sure that folks are aware that the REACH programs are reaching millions of low-income families, Hispanic families, others that are in lower resourced areas, to really ensure that we work with community engagement, community coalitions, and to really try to ensure that we're supporting families in these areas of tobacco, nutrition, and physical activity. Next slide. Thank you.
Thank you, Dr. Captain Blank. Now our next presenter is Rita Carrion. In her current position as Deputy Vice President of the Institute for Hispanic Health at Unidos US, Rita provides oversight of the Institute for Hispanic Health, which is dedicated to reducing the incidence, burden, and impact of health problems on Latinos. Ms. Carrion's areas of expertise are healthcare disparities, health equity, and health literacy, chronic care and prevention, health insurance and health policy, quality and health program development and implementation. She received a postgraduate certificate in healthcare administration from the Northwestern University and has a bachelor's degree in community and school health from California State University, Long Beach. With you, Ms. Carrion. Next slide.
Thank you, Dr. Vico Valentin. Welcome, everyone, and I also want to thank Captain Blank for a very informative presentation in terms of the data and information. I also want to thank Dr. Lin for your leadership at the Office of Minority Health. So as Dr. Vigos mentioned, I'm Rita Carrion. I'm from Unidos US, which was formerly known as the National Council of La Raza, or NCLR, or many of you may know us as La Raza. So next slide. So I just wanted to emphasize that while our name has changed, our mission has not. One of the overarching missions of our organization as we near our 50th anniversary next year is really to build a strong America by creating opportunities for Latinos. Next slide. And our vision is to really accomplish a strong America where economic, political, and social advancement is a reality for all Latinos, where all Hispanics thrive and our community's contributions are recognized. And as the largest civil rights and advocacy organization for Latinos, I want to stress that one of our main purposes, if you can put the next slide, is to really live in a world where there is no barriers for Latinos to reach their fullest potential. And as an organization, we not only work in the area of health, but we also work in a number of different areas such as immigration, education, housing, community development, workforce, and economic development, just to name a few. So next slide. For those of you who may not know Unidos US, we are, a lot of our function and what really emphasizes the work that we do is through our affiliate network. We're a network of community organizations, community-based organizations, which not only have multi-service type of areas across the country, but are also federally qualified health centers. Some are school charters. Others are, local Latino businesses, commerce of business, and a number of different other elements in terms of the work that we do. Next slide. So I wanted to talk a little bit today also not only in terms of just the statistics on what Captain Blank had mentioned around childhood obesity specifically affecting Latinos, but also just to put in perspective of the number of Latino children that are U.S. citizens. About 93% are Latino citizens. 53% are Latino children that are actually from at least one non-citizen parent, which many of them come from a mixed family status. So when we look at all our programming, we really look at it a very comprehensive view of the familia. However, 33% of all children in the United States living in poverty are Latino. And if this trend continues, by 2030, 44% of Latino children are projected to make up, to be able to live in poverty. Next slide. So one of the things that we had recently done, in terms of our work and under the Institute and the work around health and health policy, is really to look to our affiliates as to what are the things and factors that they, within their community and what they're seeing within their families and well-being. So as you can see here, access to jobs and economic opportunities rated one of the highest, but access to affordable, healthy food and physical activity was another major driver in terms of the major concerns that our affiliates who serve many of those diverse communities across the country are concerned about. Affordable housing continues to be an issue, and trauma related to immigration experience or status, and even now as we're starting to see a lot of trauma related to disaster relief as well, and access to quality education. So this is very top of mind for us in terms of not only access to healthy foods, but also affordability and ability to have a home. So next slide. When we asked our affiliates about what factors related to health and the healthcare system most impact the health and well-being of the Latino families that they serve, we, not surprisingly, we saw insurance coverage and affordability as a major impact in their concerns, but also the lowered understanding of how to utilize preventive services, how do you, ensuring that you have a culturally responsive workforce, and when you're communicating with health professionals, and this coordination of health and health healthcare services. So for us at Unidos US, one of the major drivers in terms of having access to care and having access to preventive services is critical for us. It continues to be in terms of the work that we do. Next slide. So in regards to talking to our affiliates over the last year and really looking at the overarching programs that we have developed under the Institute, or what was called the Center for Health Promotion, we really have spent a lot of time in our work around promotores de salud, our programming on specific chronic conditions and also preventive services. But one of the major drivers for us is really looking at it from the health equity lens and the health equity perspective by addressing these key social determinants of health. A lot of research has come out over the last 10, 15 years, as Catherine Black mentioned, in terms of when you think about obesity, when you think about unhealthy behaviors, it's not just individual choices that you're making or as a family that you're making, it's also the environment around you. So a key area for us is when we're looking at our priorities across the organization and looking at health, it's really, we landed in kind of these 5 areas of really shaping the public narrative about who as an organization, or not as a community, a Latino community, the value and the assets that we bring in terms of familia and respeto and trust and familismo and everything that is vibrant about our community, and making sure that we're talking about the assets that we bring to this country, fostering leadership and advocacy on key health issues such as obesity, such as advocacy and ensuring that we continue to have access to quality care, expanding where health happens and how we think about health outside of not only the doctor's office but also in the community, and the influences that we have not only in the schools but also in the community churches and other critical areas in terms of the environment. And I know that Eric will talk a little bit more about that and the impact that we've been doing in terms of just really reaching out to the Latino community. But the other 2 ones were really is to create and for us to share some actionable knowledge around data, around the importance of really digging deeper into not only the information about Latinos, but even driving down into specific ethnicities and regions, and how a lot of our health is really local. And then the 5th one is really to create that meaningful and actionable access to health and health care, and then making sure that it is responsive to the needs of our community, but also in thinking about it from a very holistic view. So next slide. So what we wanted to focus today during my presentation is to really gear on the expanding where health happens kind of portfolio. And we at Unidos US and at the Institute, we've been working for a number of years now around addressing food insecurity. We have a funded signature program called Comprando Rico y Sano that I'll talk shortly about, that really looks at food insecurity across different communities. We're also looking to improve access to a medical and dental home among children of agricultural workers. So these are migrant and seasonal farm workers, specifically within the ages of 2 to 5-year-olds, and even capturing it from a broader lens from 2 to 17. And really assessing, having programs that assess our environment, the neighborhood, and access to healthy foods and beverages, and even access to clean water. And then on our policy level, it's not only looking at it from different nutrition programs, but also looking at the marketing of unhealthy food and beverages that are often geared to our youth and to our families. Next slide. So part of our effort to advance social change is really kind of to meet where families are. And really address kind of the needs on the cultural lens of it and also the linguistic lens. Many of our programs are bilingual, and most of them are, but we also do trainings in Spanish and lead on to our leadership in the local level to ensure that we are being responsive to the specific assets. Social engagement and communication is another critical aspect that we do in terms of all of our programming. It's not only looking at it from the family perspective, but also on the communication level. So it's developing programs where we're providing enhancing the skills of our community leaders to be able for them to tell their own story and amplify their message across across the communities and advocate for their communities. And then the impact around children's poverty and health. I think that's a critical moment for us in terms of observing a large percentage of uninsured or even diverse populations that come from different aspects of that, and that connection between education and health. And so the two examples that I like to bring forward is one of our initiatives that we piloted called Cuidemos Nuestra Salud, and that was funded by the American Beverage Association, which was a pilot program to really engage not only the parents but also the youth in really looking at energy balance, looking at the balance between what you eat, drink, and do. It was geared largely for 14-year-olds, and we piloted in California and in East LA, as also in New York City. One that was a community-based organization, another one was an FQHC that also had a school-based health center and a charter school. So this was the involvement of our both of those communities to assess what's the best way to not only engage the parents but also the youth in really thinking about what they're drinking and reducing full calorie to go to low calorie soda, but even taking it even further and educating them about not only the environment and the marketing around that, but also around the importance of drinking water. So we were able, within the 1 year that we piloted that project, reached over 200 youth and caregivers in that pilot project. The other program that we have is our Healthy and Ready for the Future that intersects between education and health. And the Healthy and Ready for the Future is funded currently by Comic Relief for the Red Nose Day campaign. I think many of you may know and be familiar with Red Nose Day. And that is really to address childhood poverty one nose at a time. For our initiative, where we focus is really on the rural children between the ages of 2 to 5, actually, so that the data set there is actually 2 to 5 years old, and really reaching children who participate in our Migrant and Head Start program, and link them to a local community health center to gain access to not only a medical home but also the dental home. And throughout the process of that initiative is really not only to reach the children and their families, but also kind of to be able to provide some bilingual messaging through our radio, because we know the farm worker families, often listen to radio and move up the migrant stream, to follow the crops. And educate them about messaging, especially for mothers, in terms of breastfeeding and the importance of breastfeeding, but also, once a child is born, ensuring that the fruit juices and the intake and water and the difference between that. We were able to reach out to, in just 1 year, to 19,000 children, and being able to help them to get access to dental care. And this is important because Latino children often show up with a carie, are more likely to show up with a dental carie before they reach kindergarten. And oftentimes that could be because of the diet or not having access to care. So this is a key priority for us. We were able, through some of our social media as well as the radio campaign that we had, reach over 750,000 Latino individuals and families about the importance of oral health and health care. We know that this is kind of a critical thing of really looking at it from a very holistic way. Next slide. So our Comprando Rico y Sano program that I mentioned earlier, this is our 7th year that we've have been working with our affiliates in this space. It's a nutrition and physical activity education program geared to parents and adults over the age of 18. And in last year, we reached across 20 communities. This year, we've expanded it now to 24 communities across the country. We'll be convening our affiliates next year in Long Beach to talk a little bit about kind of how, a lot of the different changes that have been happening in their environments over these last year. But as you can see, we've been able to reach, in just that year alone, last year with 6.5 million Latinos were reached with nutrition and information about the Supplemental Nutrition Assistance Program. And the reason why I wanted to highlight this program, next slide, is because of the importance of familia. And oftentimes, of really looking towards the parents and adults and knowing the mixed family stars. And this is led by community health workers out in the community that are able to make healthier choices in terms of when where they go shopping and how to shop in the budget through the grocery store tours, but also the cooking demonstrations, and with our overarching aim to increase vegetable intake and food intake. And we've seen some changes in that. In last year alone, we reached 70,000 Latinos with face-to-face nutrition and staff education through the charlas. We also we're able to enroll about 25,000 Latinos into SNAP, and provided, some cooking demonstrations, over 4,000 of them. So we've trained promotores across the country, and they themselves have also trained additional promotores to reach out and talk about the importance of really providing and thinking about healthier eating as a familia. This year, one of the exciting things that we have done is to challenge our affiliates to really expand their classes and incorporate younger children into the education and the information that they're receiving through the charlas. We recognize that many of the participants are coming with younger children under the age of 5, and so how do we elevate and be able to expand knowledge and start them early in terms of thinking about fruits and vegetables? And so we've had, one of the beauty about Unidos US is that we've got experts in education and housing and another, and we have one of our directors for early childhood education experts out that is nationally renowned and stuff to talk to our affiliates about how children learn and think, and to be able to help with, forming their classes when involving not only the parents but also the young children. This year as well, we're actually challenging our affiliates to really think about the impact on health across in the community. So you'll be hearing a little bit more about that in the beginning of the year, about some of the things that they've been doing out in their communities to either change some policies or advocate for better school meals or other different types of healthier, safer communities or playgrounds, just to name a few. And we know that many of them are already doing it, but we want to recognize them and be able to lift up those stories. So you'll hear more about that in the coming new year. Next slide. So one of the things that I also wanted to mention is that as an organization, our roadmap that we've had over these last 3 years is really this last year is really our Protect and Defend campaign, and it's around advocacy and awareness. It's really utilizing our knowledge and information on the policy end about training individuals to be advocates for their own communities, and through a number of different angles. And then related to this is through the Child Nutrition Reauthorization Act. We're currently looking at it from also through CHIP and Medicaid expansion, and trying to ensure that does not go away. We've also developed some state profiles for key, high Latino communities in California and Texas and Florida around Latinos and food insecurity and their participation in such programs. And then, with the funding with the Robert Wood Johnson Foundation, we've also developed a series of fact sheets around taking a really closer look about Latino and child nutrition. And all those are online on our website. So one of the things, I wanted to end with you all is really how we continue to lean in And using, in terms of our other programs that we develop, using a multi-stakeholder approach across all the social services that our multi-service organizations provide, but also enhancing the role of the local leaders, of community health workers and support efforts, of thinking around and building upon the local school health administrators or school administrators. Here I have the school health administrators, but also the school administrators, the community leaders, and also the healthcare professionals, and working together, and creating opportunities for new partners to join in local coalitions to advocate for healthy communities and schools. And next slide. And one of the things that we do is through some of the coalitions on the national level that we participate in, and also look at to bring on board and spread through our Voices for Healthy Kids effort, then their campaign to enhance school health policies. Another one is the Partnership for Healthier America and their Drink Up campaign to encourage folks to drink more water. And those are just a couple of examples and stuff. But most of our research is online in terms of issue briefs, our blogs, our web stories that we tell. I would encourage you to visit us online.
Thank you, Ms. Carrion.
Gracias.
Muchas gracias. Just as a quick reminder, don't forget that you still can post questions on the question box on your right side of the screen, so feel free to send those questions to us. So our final presenter is Mr. Eric Moreno. Mr. Moreno joined the Institute for Health Promotion Research in 2015. As a research area specialist, he curates Latino childhood obesity content. This includes news, research, success stories, and helpful resources for the Institute's Salud America program. He has a Bachelor of Arts degree in English from the University of Texas at San Antonio, and he received his master's degree in communication from Gonzaga University. With you, Mr. Moreno.
Thank you very much. Thank you to the Office of Minority Health for organizing the webinar and for inviting us to speak today. And thank you to Captain Blank and to Rita for sharing this great information. A little bit about Salud America before I get started. For those of you who don't know, we are a national Latino-focused organization that creates culturally relevant research-based stories, videos, and tools to inspire people to start and support healthy changes to policies, systems, and environments where Latino children and families can equitably live, learn, work, and play. Next slide. So as you can see by the graphic on the left-hand side, 40% of Latino children are overweight or obese compared to the national average of 32%, and that is why Salud America was created. That's why we do what we do. Latinos are the largest, youngest, and fastest growing racial and ethnic minority in the country. Their overall success, especially when it comes to the health of Latino kids, is going to be crucial to the overall success of the United States for decades to come. So today I'll be discussing some of the mitigating factors that we've uncovered in our research that has led to unhealthy weight in Latino kids. I'll be discussing the work that our team has done on a series of research reviews on these factors that we've converted into some easily understandable and shareable infographics, which I'll showcase later on. And lastly, I'll share with you some of the resources and stories that Salud America has developed to address the unhealthy weight for Latino kids. Next slide. So our first research area addresses healthy spaces for Latino kids and families. So 81% of Latino neighborhoods do not have recreational facilities, and this is compared to 38% of majority white neighborhoods. And fewer Latinos say their neighborhood has safe places to for their kids to engage in physical activity or just to actually just play. We wanted to uncover the why this was the case in our research. One of the main factors we uncovered were what we classify as unpleasant neighborhood characteristics that were found in many of the Latino neighborhoods. For example, crime and the fear of crime negatively impacted the level of physical activity that Latino kids engaged in. Also, conditions such as dilapidated playgrounds, unleashed dogs, and speeding cars prohibited kids from engaging in physical activity in heavily Latino-populated neighborhoods. So some of the solutions we address in our research reviews are improving access that include adopting shared use agreements, improving the neighborhood built environments, creating safer routes to active spaces and other family destinations, and using marketing and technology to change Latino kids' physical activity patterns. Next slide. So here's one of the infographics I mentioned. So we addressed the problem. Many schools do not provide public access to physical activity facilities for Latino kids. One of the solutions we have come up with are shared use agreements. Since many schools already have these types of facilities already built, such as the playgrounds, the tracks, walking, biking trails, gymnasiums, some have swimming pools. These facilities are already there. So in a shared use agreement, we recommend that neighborhood groups be able to use these facilities after schools have closed for the day. So some of the largest groups that we see include areas in Los Angeles, including they offer Zumba classes, they offer walking spaces, walking clubs. They provide their fields for soccer and for other physical activities. So we feel that shared use agreements can increase the public's access to these active spaces, especially in heavily Latino neighborhoods. Next slide. This is our infographic on safe neighborhoods. The hours of the day in which many Latino neighborhoods work prevent them from being physically active, especially families with young children. One of the solutions we offer is making the existing parks and physical activity spaces, such as basketball courts, baseball and soccer fields, public pools, making them safer by providing access, safe access with lockable gates and improved lighting. This again, as it mentions here, this area in Chula Vista, they identified the barriers present, and they were able to repair the existing facilities, and this has greatly boosted the attendance to the park, including organized physical activity, exercise classes, and clubs. So we feel that making the park safer and more accessible can greatly improve the overall physical activity of Latino kids. Next slide. This is our infographic on our safe streets research. Street conditions in many Latino neighborhoods feature speeding cars, and a lack of sidewalks and crosswalks, and this prohibits kids from being physically active. They're high traffic areas, and the sidewalks are either in disrepair or just don't exist. Crosswalks often don't exist. Adding these amenities, the crosswalks and the sidewalks, as well as bike lanes, these investments should be made to make Latino neighborhoods safer, to encourage the physical activity among Latino kids. Next slide. So this research will address our healthy schools topic. Schools with more Latino kids tend to have weaker policies for school snacks and drinks, and Latino kids have more access than white students to unhealthy foods and drinks in school stores and the snack lines and then their vending machines. Within a few short years, 1 in 3 public school children will be Latino. The schools with the Latino majority elementary schools were less likely than white majority schools or other majority schools to offer 20 minutes of recess a day for PE or 150 minutes a week for physical activity. Latino kids already have the lowest participation rates in organized sports and after-school programs, so this is one of the areas we wanted to address. These would include implementing stronger nutrition standards for snacks and foods, and providing healthier options in school vending machines, and offering other alternatives toward instead of sugar-sweetened beverages such as water bottle stations, and also encouraging Latino students to participate in physical activity groups, especially after school, including culturally relevant programs to help reduce the barriers to access these kids have. Next slide. So here's our infographic on healthy food in schools. So Latinos have, again, more access to unhealthy snack foods and drinks in schools compared to whites. They also have less strict nutritional guidelines. By addressing these concerns, by making options healthier, including more culturally friendly food options, we find that this can help reduce the need to consume the unhealthy foods and snacks during the school day. One of our upcoming toolkits will be on introducing water bottle stations as an example of how to address the healthy drink question here in schools. So by addressing these concerns, we think we can help reduce the overall consumption of unhealthy food and drinks in schools and help reduce the overall unhealthy weight of Latino kids in schools. Our next slide. This addresses the physical activity in schools. As I mentioned, Latino majority elementary schools were less likely than white schools to offer 20 minutes of recess a day or PE for 150 minutes a week. And again, Latino kids have the lowest participation rates in organized sports and after-school programs. By making the investment in the schools to ensure physical activity for students, we think this can increase their overall health. We are also working on toolkits for introducing brain breaks into schools. These are short physical activity breaks that can be incorporated throughout the day, and they don't really need much of an investment. They can be done in classrooms. They can be done as part of lectures. They can be done during PE. This is one more way of introducing physical activity, which can obviously help reduce the obesity rates among Latino kids in schools. Next slide. So our next research topic that I wanted to address is our healthy food research. So Latino neighborhoods have 1/3 as many supermarkets as non-Latino neighborhoods. Two of the studies that we researched found that ads speaking to Spanish-speaking use are more likely to promote unhealthy foods than ads compared to the ads that were aimed at English-speaking students. The lack of overall access to fresh and healthy food options often leads Latinos to consuming what we would consider junk food and incorporating these as part of their regular diet. City governments, we found, can help overcome this barrier by encouraging supermarkets, farmers markets, and other healthy food sources to enter into these underserved neighborhoods through zoning measures, through land use planning, and then through organized community efforts. We also feel that the policymakers can address these programs by encouraging this population to purchase some of these the healthier food options at farmers markets, and expanding the options available at what would be the tiendas, the bodegas, or the corner stores. Next slide. So this is again, the infographic on the supermarkets. So again, Latino neighborhoods have 1/3 as many supermarkets as non-Latino ones. This greatly limits the access to fresh, healthy fruits like fruits and vegetables. Sorry, I lost my place on my page here. So by addressing this concern, the city can step in with incentives and zoning variances to encourage the supermarkets to move into these underserved areas. In our research, we found that stores that have done this have seen their profit margins rise because of the nature of what they're offering. So again, improving the access to the healthy food greatly can boost the economic vitality of a neighborhood and greatly increase the overall food options for Latinos in neighborhoods. Next slide. Again, here is our infographic on the tiendas, the bodegas, the neighborhood or corner stores. These stores are often the only source of foodstuffs in many Latino neighborhoods, and often they lack fresh fruit and vegetable options. We also have a research package available for those who are interested on the impact of sugary beverages. That's available on our website. So as you can see, there are certain measures that can be done to encourage these types of stores to introduce these types of food options in their facilities. One of our stories on our website features a market in the San Antonio area where, as part of a citywide program, they were gifted temporarily some refrigerated coolers so they could keep fresh fruit and vegetable in their stores. And again, they saw a dramatic rise in their profits, and again, in the people purchasing these items in their stores. So after the program ended, they opted to continue on having the refrigerated cooler in their store. So by doing programs such as this, we feel that we can encourage healthier eating options for Latinos. Next slide. And then again, here's our infographic on farmers markets. Oftentimes there just aren't any in many Latino neighborhoods. So by encouraging the farmers markets to open up in these underserved neighborhoods through incentives, we feel that that can greatly impact the overall eating habits of the residents in the area. Next slide. So the next topic I wanted to address is our healthy child research. So 1 in 4 U.S. kids are overweight by the ages of 2 to 5, and they have a higher prevalence among Latinos, which is 30% compared to white children, which is 21%. Obese Latinas who give birth to children who are 1.8 times more likely for those children to be obese as they grow older by the age of 5. So Latina moms and their babies generally face tough challenges when it comes to reaching a healthy weight. Cultural habits influence their diet, and physical inactivity in Latina moms to be as often lacking as compared to other racial and ethnic groups. New moms often face barriers to breastfeeding and good baby health habits at home, especially when they're at work or when they're kids are in childcare. As a result, the kids are more likely to grow up with an unhealthy weight and to suffer from diabetes. So we feel this can be addressed at a policy level to encourage breastfeeding by marketing reductions in formula, by having paid maternity leaves and offering break time in private places for Latinas to breastfeed. And they should, we feel they should also encourage healthier eating and physical activity standards while they're in early child care centers, especially when they don't provide those things. Next slide. So here is the infographic on healthy moms. Again, as I mentioned, the obese Latina moms are 1.8 times more likely to have obese children before the age of 5. So by encouraging healthy eating and physical activities that can be established early on, especially while they are pregnant, this can help foster lifelong healthier eating habits among their children. Next slide. This infographic addresses our research on breastfeeding. So again, less than 50% of Latino moms we uncovered in our research still breastfeed their newborns by the age of 6 months. Breastfeeding for 1 year or more resulted in a 47% reduction in obesity rates among Latino kids, and this significantly protected the kids from being obese through the age of 4. We found that breastfeeding also helps, as it contains nutrients for proper infant development. This helps reduce the risk of asthma or allergies and helps fight off viruses and bacteria. And it's also been linked to higher IQ scores later in childhood. By encouraging workplace programs that foster an environment for breastfeeding, and we feel this can greatly help reduce the overall obesity rate among children for Latinos. Next slide. And this is the last infographic I want to cover. It covers the early child care centers. Nearly half of Latino infants watch TV more than 25 minutes per day. Fewer Latino infants than white infants get regular tummy time activity. Addressing these is key, and we feel this can be done through concerted marketing efforts, encouraging healthier behavior for Latino kids, especially in these early child care centers where parents aren't there. Overall education is key. We think offering bilingual educational materials, programs such as promotoras that kind of encourage these behaviors. These can also greatly help establish healthier habits for Latino kids. Next slide. So now I want to talk about some of the resources that Salud America offers, and the first thing I want to talk about is our Salud Heroes, and I have a couple of slides here covering these. Salud Heroes are what we dub people who have gone out into the communities and affected a change either in a policy or in an overall culture. We feel these are important because they show what a person can do and how a person can get the metaphorical ball rolling to help a community. My coworkers and I searched the country looking for these stories of people, groups, individuals, and that are actually making these changes in the community. And in these stories, we walk through the process of how they got things started from the germ of an idea to actual implementing the project and then ultimately sustaining them. In addition to these long-form stories, we do a video interview with the subject that we promote through our social media channels. And so here are some of the stories that we've come up with that address our research topics. In Minneapolis, there was a community group helped reduce sugar-sweetened beverages in the Minneapolis public schools by creating bilingual educational materials that they introduced at the school. here in San Antonio, some community advocates helped create these community baby showers, which invited dozens of Latina mothers, well, not just Latina mothers, but they invited dozens of mothers to these baby showers that gave them prenatal screenings, health classes, parenting classes, and kind of instructed them on the importance of breastfeeding after they've given birth. The last slide here, a community group in El Paso helped get a school partnership going to introduce physical activities classes during schools for kids, both before, during, and after school. They saw great turnout from what there was very little turnout in after-school programs before the program existed, and once this was introduced, we saw a remarkable improvement. Next slide. And I apologize, I think I put the wrong photo on this middle slide there, so my apologies for that. But again, there's some more stories that we've covered along the way. In Colorado, there was a teacher who wanted to get community gardens installed on the school grounds, so the teachers helped plant the gardens along with the students, and they have a dedicated class to helping tend the garden, and the food from the garden is used in the school, so it helps students learn where the food comes from and how they can implement it in their recipes. They're able to also take some of this food home with them to their families, so they can incorporate them into their dinners at home. Again, here in San Antonio, in a primarily Latino neighborhood, there was very little existing infrastructure when it came to bike lanes, sidewalks, and crosswalks. So an architect in the area started a community organization to petition the city to introduce, as part of the budget, funding for these infrastructure needs in the community, and they actually got that approved. So they worked at a very grassroots level, going to city council meetings, town halls, that sort of thing, and they actually got the changes done. And lastly, in Austin, one of the school district's chefs wanted to introduce culturally appropriate food options into school lunches during the school year. So they worked with planners to create healthy Latino flavored meals that were offered at the elementary school levels. Last slide. I'm sorry, next slide. So again, this is on our website. This is how people can access our Salud Hero stories. We have them broken into our different topic areas. We also encourage people to submit hero ideas to us that we can kind of research on our own, and we can go out in the community and get these stories publicized. Next slide. And our next resource I want to talk about is our Salud report cards and our Salud 2's tweet chats. For our Salud report cards, we wanted to offer a kind of one-stop tool that captures all of the data available, and we wanted to have one place where someone can get a snapshot picture of the health in their community. So someone can go to our site, and the report cards are free. They can go in and type in their county and get this report card it's instantaneous, and it has data on the overall obesity levels as they compare to the state and national averages. And the reports talk about the levels of food access, the healthy food options, the grocery stores in the communities, the number of parks and other physical activity spaces in the area, public pools, soccer fields, baseball fields, that sort of thing. And then the number of motor vehicle pedestrian accidents, which factors into the area's walkability. Whoever accesses these can download them as a PDF that's shareable, and that was kind of our ultimate goal when creating these. We wanted them to be able to share it with the people who can make the changes, either at the big P policy level or at the little P policy level. So we've had some success with these. We've had over 115 since we started these in June of last year. Someone worked with us in the city of El Paso to get to work with the schools to introduce healthier nutrition standards at El Paso ID. So that was kind of what we consider our big win for those. And if people are interested, they can follow the web link there when they have a chance. Also, I want to talk about our Salud 2's tweet chats. Early on in the formation of Salud America, we identified that Latinos are one of the most socially active in terms of online social media groups in the United States, and we wanted to find a better way to interact with them and engage in them better. We created the Salud tweet chats as a way to do this, and also as a way to help promote our research and our content. So each chat, we do these every Tuesday for 1 hour from noon to 1 Central Time. Each chat covers a unique topic that addresses Latino health. We partner with 2 to 3 organizations and experts on the topic, and we engage in this hour-long topic addressing specific questions and then sharing ultimately resources that everyone can utilize. We actually, the graphic on the right is for our upcoming chat next Tuesday, where we'll be releasing our new research on family and social support for Latinos. We found that each one of the chats, the reach is into the millions, and they are frequently a trending topic on Twitter for the hour that we do them. They've been one of the most successful ways that we've been able to engage our audience, and they have been proven successful in helping to disseminate our research and our content as we see large spikes in traffic on our website during that day. And we frequently get requests emailed to us after the chat. So last slide, I think. So that's all I have. Here is how you can find me and Salud America online, and I greatly thank you for allowing me the chance to talk to you today, and I look forward to hearing your questions.
Thank you, Mr. Moreno.
Thank you.
We encourage you now to download and use the new animated cards that we developed to create awareness about childhood obesity and encourage parents and caregivers to shift the balance between screen time and active play, and also provide tips and recommendations for better nutrition. Next slide. So I also want to invite you to visit OMA's website to obtain additional information on minority health and the Hispanic Heritage Month website, which has prevalence data and additional information on childhood obesity and other diseases and conditions that affect Latinos. This concludes our presentation for today, and we will now take questions from the audience. We have the first question is for Captain Blank. How can individuals or groups explore more information on data and solutions?
Earlier slides. Hi, thank you for the question. So on one of the earlier slides, we provided the dashboard called Data Trends and Maps. So we invite everyone to take a look at the national, state, and where available local data related to policy systems and environments, as well as the behaviors that we've talked about today. Thank you.
Thank you. We have also a question for Ms. Rita Carrion. How can we collaborate with the Comprando Rico y Sano program?
Thank you for the question. We have about 24 affiliates that are working locally, so you can reach out to us at Unidos US. We do have a website and a web page with contact information for my team members, and then we can connect you with the local areas if that's an area that you want to reach out, or if you want to work with us specifically at Unidos US. We're happy to do that.
Thank you. We have another question for Mr. Moreno. Why did you choose to use the role model-based approach?
Oh, great. Thank you for the question. During the initial research of Salud America, it was determined that the community we were trying to impact, especially for immigrant and non-native speakers, that having these role model typed examples were going to be the best motivating impact for them. Finding someone in the community who was actually making the change and actually doing the healthy behavior was going to have the greatest impact for those in their community. Seeing someone who was like them doing this was going to have the biggest impact on them.
Thank you. The next question is for Captain Blank. What is the difference between plain water and tap water?
Hi, thank you for the question. So plain water captures both bottled water and tap water. So tap water is just a subset of what we call plain water. And typically, plain water can include water that has a little bit of fruit added to it, so something that you put a lime, a lemon, a cucumber. So it's non-sweetened water. Thanks.
Thank you. Next question is for Ms. Rita Garrion. How can we get training for promotoras and promotores?
You can reach out again to us. So specifically, I wasn't sure if I had left my contact information. I think if you can download the slides, you can reach out. Depending on the topic or issue that you want to get trained on, but with the Comprando Rico y Sano program, that one is specifically around nutrition and physical education. But we've also had done some training around a number of different chronic conditions as well.
Thank you. And I think we still have time for one more question. I will go to Mr. Moreno. Are you providing educational materials for promotores de salud in the San Antonio area?
Yes, we can do that if they have access to my contact information or via our website. We have that sort of information there. We have numerous examples of promotores in not only in San Antonio but across the country.
Oh, we have one last question. So the biggest issue is income and cost of living in these communities. This question will go for anyone or everyone if you want to answer or provide your opinion or your point of view on this question. Do you suggest for direct outreach? When the biggest issue is income and cost of living in these communities, what do you suggest for direct outreach?
This is Rita. If I'm understanding the question is for those that may have challenges in accessing food due to their income and the cost of living, how do we reach out to those communities? Is that if that's the question, then I would say many of our affiliates, with the programs that they provide are free of charge. And with the Comprando Rico y Sano program specifically, we also work with the participants to not only when they're doing the grocery store tours, but really shop on a budget. So there's a challenge of a $5 challenge to how you can purchase foods that are healthy with minimal amount. But then we also know, because food insecurity is a major issue and problem in our communities, we, for those that are eligible, can apply for the Supplemental Nutrition Assistance Program and be able to gain access to some healthy foods.
Thank you. In the research presented, how was education conducted with parents? And that can be answered by anyone.
So, Eric, I think that was related to the infographic information you had on less access to parks.
Okay. So again, our research reviews take into account everything that's available for us, and we have engaged directly in certain communities to poll Latino parents. That's how we were able to kind of gather that information for our research.
And there are a couple other sources if folks are interested. The Trust for Public Lands has a dashboard, and then also sometimes we go to the National Rec and Park Association, NRPA. They also have, not all of those are free resources, but for groups that are interested, those are a couple sources that we often look at. CDC also has a state indicator report on physical activity. It's not broken down by certain communities, but at least it gives you a state snapshot that also can provide some baseline information on whether you're seeing disparities in park access.
Thank you. We have one more question for Captain Blank. Do obesity rates for Latino children differ across the U.S.?
That's a great question. We only really have 1 or 2 data sites that have enough detail on children by state. That's the Youth Risk Behavioral Surveillance System, the YRBS that I showed. That's self-reported data. And we do see some differences kind of by region, where we can see some of the southern states. We see that overall, and then we also see it by stratification by Latino status. And then the other is, I think, the National Survey of Children's Health that just recently was published. And I know currently the Trust for America's Health website has that data broken down by state. I'm not sure if it's broken down by race, ethnicity, but I'll take a look at that to be able to answer that better in the future. But those are the 2 kind of state data systems we have right now where we're able to look at that. When we look at it by the WIC children, that's our 2 to 4-year-olds, there are some differences, and I would suggest for people to go to that data trends and maps, and you can specifically look. Again, that's only by state, but it does have a stratification by race, ethnicity. We do see some minor differences, and a lot of that you can see by region. So the Midwest and the South tend to have higher rates of Latino obesity as well. Thank you.
Thank you. Just another question in regard to data. Is there any data sets that would allow researchers to look at the Latino obesity rates in a disaggregated way for Latinos? Meaning looking at different Hispanic subgroups.
Yeah, that's a great question. I know in our national data right now it does break down because of an oversample, Mexican American heritage versus other Hispanic. That's probably the largest data set that has that. I would think that the California Health Interview Survey might be another place to look because of California having a good sampling frame that it uses for the CHIS. But those might be 2 places to look. I have heard that census and other demographers are looking at better ways to capture race ethnicity going forward, I think starting probably in 2019, 2020 as we think about the new census. So I'm hopeful that we'll potentially have better data going forward. Thank you.
And the next question will be for any presenter that would like to answer the question. Does bad food cost less than good food? And obesity, can obesity be caused by a lack of funds?
Well, this is Heidi. I'll start. We have looked at some papers by Drunowski and others that have looked at the cost of good nutrient calories versus probably poor nutrients. So again, the snacks, the sugary drinks, and things like that. There is some data to suggest, and we know from some other USDA data that certain fruits and vegetables can cost a bit more, right, than other kind of candy and those kind of products. So if we look at it per nutrient, but I think that comes back to what Rita said is really working with families on healthy meal planning, on culturally relevant foods, and ways to, if folks are spending money, if they have tap water that's safe in their communities, or we'd really like to have folks spending their household on more fruits and vegetables and other kinds of healthier foods. So we're definitely working with folks to purchase less of kind of sugary drinks and bottled water where we know we have safe tap water.
Thank you. Any additional questions? You still have 1 minute to post your question. In the meantime, we want to thank those attendees that have posted questions and the presenters for providing such an important information and answers to those questions. So since we don't have more questions, I would like, next slide, I would like to provide information about our next webinar, which is Nuts and Bolts of Faith-Based Organizations and the Health of Their Communities, which will be in October 24th at 11 a.m. We want to thank, again, Dr. Lin for being with us today, and thank you, presenters, for such excellent and thought-provoking presentations. Each of you will receive an email with a recording of today's webinar, and there will be a link included for you to complete a short evaluation. So please complete the evaluation because your feedback is valuable to us, so I encourage you to complete the survey. And thank you again for joining us today. For more information about the Office of Minority Health, please visit www.minorityhealth.hhs.gov. Thank you.